Hi, my name is Caitlin Sweeney.
My name is Keontae Hawkins.
And my name is Caitlin Seaborn. Today we're going to be talking to you about audiograms and the different types of hearing loss. We will be starting off with audiograms.
As you can see, an audiogram is a graph that shows a person's hearing. It shows a threshold, which measures the lowest frequency someone can hear 50% of the time. This is known as the threshold. The x-axis tells us our frequency or pitch, which is how high or low a sound is, and the y-axis tells us the intensity or loudness of the sound. To the right is a picture of a blank audiogram. The red and black straight lines indicate where normal hearing would be. A hearing loss would be plotted.
So what is an audiogram? An audiogram is basically a graph that is specific to your hearing. It's an easy way to visualize where sounds are experienced and with a simple hearing test where you fall in that graph. The graph shows the frequency of the sounds you can hear as well as the intensity of those sounds. Frequency or pitch is measured in hertz. Low frequencies like lawnmowers and bass guitars are represented on the left side of the audiogram, and high frequencies such as birds chirping or bells ringing are represented on the right. The intensity relates to how loud or soft a sound is and is measured in decibels. Each horizontal line on the audiogram represents a different intensity level. Loud sounds like a jet engine or jackhammer will show up at the bottom of the graph. Quieter sounds like running water or leaves rustling will show up at the top. After your hearing test, your results will show up independently for each ear. The results for your right ear are indicated in red, and the left ear are shown in blue. Hearing loss is determined on where those red and blue points show up on the graph compared to normal hearing. Under most circumstances, your ears hear within certain ranges, and if you're not hearing those sounds in those ranges, you may have a hearing loss. The further away from those ranges you are reflects how severe your hearing loss may be. Hearing loss is classified into 5 different levels of that hearing threshold. The threshold categories for types of hearing loss are normal, mild, moderate, severe, and profound. But don't worry, most types of hearing loss can be improved with the help of modern hearing aids and exciting new technology. If your hearing test shows a hearing loss, your hearing healthcare provider will explain the different benefits and options to fit your needs and lifestyle, and help find the right hearing aids for you. For more information or to find a professional near you, visit resound.com/findaprofessional.
As you learned from the video, an audiogram helps the speech-language pathologist and the audiologist determine the type and severity of hearing loss. The 3 different types can be conductive, sensorineural, and mixed. We'll be diving into those a little bit more later. To the right, you can see the different levels of hearing loss.
This is another more detailed picture of an audiogram explaining where the different levels of hearing loss would be seen on the audiogram. The first type of hearing loss that we will be discussing is conductive hearing loss. A conductive hearing loss happens when the sound cannot get through the outer and middle ear. A person experiencing this may not be able to hear soft sounds, and louder sounds may be muffled. There are many causes of conductive hearing loss as seen on this slide. Some of the most common causes include middle ear fluid resulting from a cold or allergies, several ear infections, or excess rumen in the ear. Now that we have covered some causes, let's look into different treatment options. A conductive hearing loss is most commonly treated through surgery or medicine. If someone has a conductive hearing loss after experiencing hearing loss from head trauma, chronic ear infections, middle ear fluid, tumors, absence of the ear canal, failure to open ear canal, or malformation of the middle ear structures, surgery may be the best option. Acute infections may simply require medication. Another treatment option would be to look towards amplification systems. Some options include a bone conduction hearing aid, a surgically implanted device such as a Baha, or a hearing aid. A bone conduction hearing aid will create vibrations that move across the skull to the inner ear. A Baha is a bone-anchored hearing aid. A Baha stimulates the cochlea by transmitting the sound waves through the bone in our skull. Lastly, a hearing aid is a small device that you wear behind your ear. The 3 basic parts are a microphone, amplifier, and speaker. Near the bottom right part of your screen, a picture of a Baha is shown. The left side represents the Baha system, while the right side shows where the sound processor is placed. This is a picture of a conductive hearing loss on an audiogram. We can see the X and Y axis with our intensity and frequency at the top. A conductive hearing loss is diagnosed when bone conduction thresholds are 15 or more decibels higher than the air conduction thresholds. Bone conduction is plotted by a bracket and air conduction is seen using the X. This is a hearing loss in the mild to moderate range because the hearing loss is 21 to 55 decibels lower than normal limits. Caitlin will now be talking to you about sensorineural hearing loss.
The second type of hearing loss we're going to be discussing is sensorineural hearing loss. Sensorineural hearing loss, or SNHL, happens after inner ear damage. Problems with the nerve pathways from your inner ear to your brain can also cause SNHL. Soft sounds may be hard to hear. Even louder sounds can be unclear or may sound muffled. This is the most common type of permanent hearing loss. Most of the time, medicine or surgery cannot fix SNHL. Hearing aids may help you hear. On this slide, you will find several causes of sensorineural hearing loss. These include exposure to loud noises, such as gunshots, head trauma, viruses, autoimmune inner ear disease, aging, malformation of the ear structures, Meniere's disease, tumors, or otosclerosis. Otosclerosis is known as a disorder where tiny growths form in the middle ear. This results in a lack of vibration of small bones in the inner ear when it is stimulated by sound. A sensorineural hearing loss can affect the patient in different ways depending on if it is in both or in just one ear. If it is present in both ears, the person may have difficulty understanding speech even if it is at a loud volume. If the hearing loss is in one ear, the person may have difficulty locating sounds as the hearing while background noises is present. Since a sensorineural hearing loss is irreversible, it is important to look at different treatment options. One of the options would be a hearing aid. Hearing aids do, however, require some level of usable hearing. Another option for this type of hearing loss would be a cochlear implant. This is an electronic device that bypasses the damaged inner ear and it stimulates the nerve endings directly. Hearing aids amplify sound while cochlear implants convert sound waves into electrical impulses.
This is a picture of a sensorineural hearing loss on an audiogram. A sensorineural hearing loss is defined by both air and bone conduction thresholds being lower than normal. Air conduction is marked by a circle and bone conduction is marked by an arrow facing left. The sloping line indicates the hearing loss.
The final type of hearing loss we're going to discuss is mixed hearing loss. Mixed hearing loss is a type of hearing loss that has both conductive and sensorineural causes. Mixed hearing loss is caused by a combination of conductive damage to the outer or middle ear and sensorineural damage to the inner ear and/or auditory nerve. The symptoms of a mixed hearing loss are reduced hearing in one or both ears. Causes for the conductive aspect of mixed hearing loss could be earwax, fluid in the middle ear, an ear infection, perforated eardrum, and malformation of the outer or middle ear. These factors combined with someone's genetics, overexposure to loud noise, taking certain medications, and the normal aging process will result in mixed hearing loss. Conductive hearing loss is treated medically or surgically. On the other hand, sensorineural hearing loss is typically treated with hearing aids. Since mixed hearing loss is a combination of both, as a result, its treatment will also be a combination of both medical or surgical treatments and the use of hearing aids. There are some cases where implants or special types of hearing aids are needed for the treatment of mixed hearing loss. This is a picture of an audiogram that shows mixed hearing loss in the left ear. As you can see, both the air conduction and bone conduction are in the abnormal range, with the air-bone gap being greater than 10 decibels.
We hope that you have enjoyed our presentation and have learned a lot of useful information on audiograms and hearing loss. Thank you.